Good afternoon, everybody. I was just making an observation to the organizers that this is an unusual pathologist conference because there's at least 3 hours of talking time, which is talking not about slides and histopathology and smears. We're talking about workflow and IT and management. So I think it's a sign the times are changing and different areas of interest and emphasis are coming in. I'd like to thank the organizers again for this opportunity, and this is a topic that I have not talked about before, although we deal with it in our everyday life. So I did my reading and realized that I'm not going to be telling you anything new. I think I'll see a lot of heads nodding during this session, not of sleep, I presume. I'm sure you'll be in agreement with me because many of these things are things that we practice every day. Some of the things we understand and we know. Some of the things we'd like to, it will be like those puzzles where you rearrange the pieces and you have the aha moment at the end of it. So what we're going to see is why it's important to manage workflow, what are the different approaches that can be used, what are the tools that can be used, a couple of short case studies from our experience, and then we'll summarize. The short recipe is these 4 points. Know your lab, ask some questions, create systems. That's very important. You have to create systems. And then managing your team, your people who are the vendors and the team that you work with, your clinicians who you report to, the patients whom you serve. There's this old cliche saying, think outside the box. Sometimes you need to, but that might not always work. There are certain paradigms that we all work under, and that is essential to work. The key thing over here, I think, is this point of asking questions. If you don't ask questions, you are not going to be getting any answers in the future. So be sure that when you walk in, you see something happening, ask a question. Why is this so? How can this become better? Or what is going wrong with this? If you don't ask a question, you won't get an answer. And I see there are feedback forms here today. So it's part of a process that we all understand. There are many factors in this, and some of these we will touch on, some of these we will not. But you should also, as was mentioned in the previous talk, know where you're going, what is your mission, who you're trying to cater to, and what are the people that you're trying to work with, and the levels of operations that we will see. If I was doing a really good talk, then the distance between this and that would be weighted, and you'd know that this is more important than the other. It's not that way. Those are those factors which I thought really influence our day-to-day life. Quality and quality systems. I talk a lot about quality because we do some proficiency testing programs ourselves. It's not an option. There needs to be intent, there needs to be planning and consistent application. And this we need to keep at the back of our mind as we go through this. Now, this was talked about in the morning in Dr. Sujay's presentation as well, and it's also called the brain-to-brain cycle, where it starts with somebody who decides to put in a request, the pre-analytic phase, analytic, post-analytic, and the reports which finish the cycle of lab testing. I'd like to add a couple of enhancements, and the important thing to remember is the patient over there with whom things start and things finish. If you don't keep that perspective, we often tend to lose out on this. So then there is the physician brain also, which comes into that. People who make the decisions as to which test to do and which test not to order. A long time ago when I was doing an internship, there was a physician who came and stood at the bedside and said, okay, what are the tests you want at the end of the presentation of the case? And we did the presentation, and then he asked a very strange question. He said, what is the pretest probability of getting a positive answer on this? And it's quite obvious that as interns, we had no clue about that. But now thinking about it, it's important for us to know these factors, not merely just the sensitivity and the specificity, but to help our clinicians to make the right test. Quality at the heart of all this, and quality management systems we'll talk about. Revenue cycle, enough has been said in the previous presentation, so that's something which is very important. Sometimes we don't pay attention to it, but we need to. I'll skip this slide quickly because this is again what we saw in the morning. The various points at which samples come into the lab, the processes that happen in the lab, pre-analytic processing, especially in clinical lab and in any kind of lab, there is a fair bit of pre-analytic processing. The analysis part, verification, interpretation, and release of results, the associated things. Now, someone here a little while ago was asking me where I work. So I said I work in a medical college. So he's saying, how come we got medical college people to talk to practicing pathologists? I think wherever you are, whatever kind of practice you are in, as we'll go through this presentation, you'll see that the points that you are going to hit are similar. The scale of it and the proportion of it might be different, but you are going to touch on all these issues when you go into practice. So I've just categorized it. This is, again, not official. This is my own thought of it. And I thought of small and medium labs versus large laboratories. And then we'll have the extra large, massive corporate operations in the next slide. So you need to know, when I talked about knowing what you want to do, you need to know who the client is and who you're going to work for and how much of work you're going to put in, because that will help you do all this kind of planning. And this then drives how much of people you need and what kind of people you need at which time of the day to make sure that your operations are successful. So even within our hospital, we have smaller laboratories, we have larger laboratories, we have areas which work only for 1 shift or 2 shifts, and then we have areas which work complete 3 or 4 shifts a day. You need to know where your specimens are going to come in from so that you can plan accordingly. You need to know which time of the day is most busy, which time of the day you're going to get more specimens coming into the lab. Look at how you can even it out. And then about where the lab is going to be. Is it a single location? Is it multiple locations within one campus, in multiple campuses? How are you going to connect up? What are the issues that are going to arise from having multiple sites? Analytic process, I've just said L1 automation, where you might have very little automation in the true sense of island automation, but it might be at least semi-automated. Larger are island automation, where your analytical processes are completely automated and your pre and post analytic automation might be less than, there are variable degrees of pre and post analytic automation. Now reporting again, it has become more and more cost efficient to go electronic with reporting processes. So depends on what your customers expect from you. Are you going to send a letter? Are you going to give it to the patient? When are you going to inform them? How are you going to inform them that the test report is ready and that they need to come back in and collect it? So these are different problems at different places. For us, for instance, we are a completely hospital-based system. So my reports need to go online. The clinicians should be able to see it anywhere within the hospital system. Some of our campuses are distributed, so they need to be able to see it across the distance also. So you need to plan for that and see what is the most efficient way of doing it. And you will definitely run into issues, especially with accreditation bodies. When you have multiple campuses, you have electronic-only systems. Very large laboratories, these are the large corporate laboratories which run with multiple campuses, multiple sites, multiple cities. And the problems which are faced by them are going to be even more different, and starts from where you're going to get the samples, how the samples are going to be transported, because the pre-analytics then kick in and become a very significant part of your issues, because you get a bad sample in and then you have bad reports which fall off that. Total lab automation is more likely in a large setup like this, because otherwise it's not viable. The previous speaker was talking about, where you have samples which move on automated platforms throughout the laboratory, pre-analytical processing, centrifuging, putting onto the machine, taking it off the analyzer and archiving it, etc. Different types of reporting systems using fax or email or web-based systems need to be decided according to this. Now, regardless of all this, there are different areas that we will all face. Specimen collection, for instance, all the points that I've talked about earlier also. What is the timing? What is the container to use? What is the draw order? Volume, special criteria, queue management. Is there some way of automating some parts of it, especially the identification and the identity management part of it? Specimen transport, is it going to be manual, automated? Manual means that somebody is going to have to take the sample from the collection point into the lab at every so many hours or so many minutes, so that work can go on. If you have a chute system, then you can send it across in the pneumatic chute system. missing persons and samples. We've had problems where we have ward attenders who are supposed to take the samples to the lab, and it takes its own sweet time because then they meet people on the way, they have to go out for coffee, and then the sample leaches in its own good time. Tracking of samples. Now, it depends on how much of IT you have and how much of penetration of IT you have to make sure that this happens. We have some areas, and I'll show that to you in our system. Pre-analytical processing. I think it makes sense to have common pre-analytical processing in laboratories. Unfortunately, we inherit systems, and in our system, we have inherited different departments. So in some places, it is not cost effective to have common pre-analytical processing. So every lab will have centrifuges in the front end. Every lab will have registration stations. So these are things that you need to plan based on how you're going to do your work and what your model of the laboratory is. Analytical issues I won't talk about. Enough has been said about it already, and we all understand issues of quality. Post-analytical process of verification. Is it manual verification? Is it automated? Are you using rule-based systems in the laboratory? With the new NABL 15189 for this last version, 2012, actually allows you to do auto-verification, and there are rules to validate it. So I think more labs will go into this area from now on. How to decide on reflex testing additional samples. Rule-based systems often allow to standardize work, and we'll talk about it briefly. Reporting, how to prioritize samples, interpretation, manual or automated, critical value alerts, and how you're going to reach your clients. There are rules where we have to call in the reports. There are situations where you have to call in the reports. It's hard to reach a particular clinician because often in a system like ours, we have multiple levels of people who look after patients, and then it's sometimes difficult to actually reach the doctor who started off the order process. So there are different approaches to this. The Lean or the Toyota management system, the Toyota production system was one of the earliest which came into the industry. It is slowly now making its way into the healthcare industry as well. Six Sigma, total quality management. I've added Henry Ford production system because the chairman of the place where I trained earlier said he was bringing back Toyota into the US, and because we were a hospital which is affiliated to the Henry Ford Group, part of our training was to visit the F1 Ford factory and see how an industry works before we came back and did lean systems in the pathology lab. You can have your own system. It's not necessary to have a named system. Getting one of these consultants in and doing an analysis is possible in the country now, though it's, I think, still fairly expensive. What is lean? In one slide, I would think this is as much lean as we can take home today. It's essentially what we've been trained to practice. And I think as pathologists, we've been trained a little more to be thrifty and frugal. And this is what it is about. But it is always good to go back and look at our systems in the light of this to see, is this where we are?